Welcome, everyone. It's great to see you today. So as Kim said, I am Megan Current-Carey, the Director of Rehab Services. And I'm excited to introduce our speakers today. We have representatives from our physical, occupational, and speech therapy department to talk about some healthy aging. So first of all, we have Trenda. She is one of our physical therapists, Mindy, an OT, and then Allison, a speech language pathologist. So I will pass it on over to you.
Thank you for coming. I'm Mindy. I'm from the region area, so a little bit of background about me. I've been a therapist for 20 plus years, and I joined Astera Health about 4 years ago. So I'm excited to be here and help with a little presentation here about healthy aging and all the things that kind of relate to as we're getting older. My background is occupational therapy, and no, it's not to enlist you in an additional employment. So occupation is defined as your day-to-day living. So all the things that you need to do to take care of yourself, to take care of loved ones, to participate in all those things, to remain, a key word would be as independent as possible. So we're just really pleased to have everybody here, and I'll start with our slideshow here. So occupational therapy in relation to this topic, we really deal with things like fine motor skills. That would be your hands, manipulating things, being able to go through your day, to be able to open things, to button things, snap things. As we age, we definitely can notice structure changes, things like arthritis. Those kinds of things occupational therapy can help you with. Misnomer is the idea that we can rid arthritis. We can't, but occupational therapists are really good at helping you navigate things. If it's something that we can help you get stronger in, of course, but also it might not be that your strength may not develop back to what it was, but we can help you with accommodations and adaptations. So definitely in the hands and arms region, we as occupational therapists can help you with that. So that kind of falls into the next category of activities of daily living. Life skills, like I said, you know, the day-to-day things. We're talking about getting dressed, being able to open packages and containers well, to be able to cook, clean, navigate, you know, in and out of your environment, whether that be apartments, homes, where you're living. So I just kind of posed, think about the things as you're aging. Can you or your loved ones open things, pill bottles, the pill minders, sometimes even those little levers or those little containers can be very difficult to navigate. Buttons and zippers. We're in a climate that we do definitely have changes in our dressing and our clothing. So, you know, we can tell by a lot of times if persons have difficulty with navigating buttons and zippers. Even putting little key rings on your zipper to be able to pull it up strong enough. I mean, there's just all kinds of nice little tips and tricks of the trade that we can help you with. Just a personal experience is even just writing, handwriting, our checkbooks and how tiny they are and how it's difficult to navigate those small little lines, and how even a large barreled pen, they even have specialty pens, even at your local box stores, that are for arthritis, and the ink will flow easier, so you don't have to press as hard. So little ideas like that. I'm a real big proponent of making sure you keep your eye exams up to date, making sure that you get your eyes checked every year, and making sure that you're up to date on all your glasses or your prescriptions that you might need, just because navigating different lighting can be a real struggle going from inside to outside. Our snow is very blinding, so that can really make it a challenge to be able to navigate outside. You might not see a dip in the ground level if you're out when it's really, really bright. I really like to talk about night lights. Night lights are our friends. So make sure you have night lights out, and we're getting really dark now that time change is happening. So night lights are really important so that when you're up and you're navigating in the middle of the night to get to another room, typically it's a bathroom, but usually most falls happen at night and happen near or in the bathroom. So having your night lights on every night, even those ones that are dusk to dawn, those work really well too. So that is our bathroom idea. So keeping your bathroom safe, making sure that you can navigate in there, picking up throw rugs so that you don't shuffle, accidentally trip over a rug. Those are really important, and we definitely have a lot of therapists that have gone out to homes to double check, if somebody has fallen multiple times, is there just a couple of things that maybe you need to navigate safer. We also have our community paramedic, and he helps with some of those safety assessments as well. Keeping active is really important, and a lot of times here physical therapy and occupational therapy might overlap with movement and keeping our joints and our bodies healthy and moving. But look to your local communities, look to your local places that might offer classes or stretching or movement kind of classes. There's often a lot of resources that we don't really necessarily know about that maybe offer those. And nowadays with electronics, we're really getting really wise on pulling up those YouTube videos and being able to follow along and being able to pause and be able to reverse and all that so that you can navigate maybe some videos on YouTube and stretching and chair exercises. So your little handout will have just kind of some ideas of things. They're pretty generic, and we went with some things for stretching. So physical therapy, Trenda will go over the ones that are kind of at the beginning, and then we even have just some arm ones while you're sitting to do some stretching and keeping those shoulders and joints flexible too. So another thing I like to talk about is wearing really, really supportive shoes. We have a lot of opportunity with technology, and we have, sandals, we have mules, we have all those kinds of things, but I really encourage people to wear a heeled shoe, to stay in your shoe. And nowadays, you can ask my father-in-law. He is now probably the advocate for Skechers, but he loves these no tie shoe that you can slip into. A lot of times, it's difficult to bend over, get your shoes tied tight enough. But there's a lot of different brands out there for the no tie shoes. Things, like I said, to help with your hands, opening things. Even Amazon has kits of different types of jar openers, can openers. Some are battery operated, some are not, but it's really interesting. I learn a lot from my patients that maybe have already purchased some of these and that they've showed me how well they work. So think of devices or things that can help you with navigating in and around your home. And I talked about pencils and pens for handwriting. And I'll pass this to Trenda.
I'm Trenda Humberg. I have been here for about 6 years. I'm local, so happy to be here today to talk about getting you moving. So it's been known that physical therapy used to be provided to individuals that only have injuries, but in today's world, it's really evolved a little bit more. And so now we're able to oversee that, and we actually work on preventing some of those injuries. So we work on maybe before a total joint, before you're having your knee replaced, or before you're having your hip replaced. We really try to focus on some of those strengthening exercises before you go into that surgery. So coming into an evaluation, some of the things that we'll look at for your evaluation is flexibility, strength, endurance, and balance. Balance is a big one that we think about as we start to age a little bit more. Flexibility. So thinking about, is it a little bit harder to reach up in that top cabinet with those shoulders? Is it harder to reach for those cups in the back cupboard? Bending down to tie your shoe. Mindy talked about getting some slip-in shoes. Is it because we're not able to bend as well with those knees? Strength. Are you able to walk to the mailbox as much as you used to? Are you able to get to the mailbox and do your legs feel like they're jello? Are you able to make it all the way there, or do you need to sit down? Endurance, do you feel winded? Do you feel like you're getting heavy breathing while you get there? Or is it that strength piece a little bit more? They all correlate together. The other part is that balance. So have you noticed that we're feeling a little unsteady on our feet? Do you need just a little bit of support? Are you walking in the bathroom, using those walls to touch just to give you that little bit of support? The other thing that I want to talk about is walking every day, okay? It really looks at a healthy aging, looks at the 30 minutes of walking per day. So they really recommend that you get 150 minutes of exercise per week. So I put on 30 minutes a day, trying to get roughly 30 minutes a day for 5 days a week. Now that might not look like 30 minutes the whole time. You can do 10 minutes in the morning, 10 minutes in the evening, and then 10 minutes throughout your day wherever else it may be. Also thinking about some of the videos that Mindy talked about, going on YouTube, getting some of those exercise and videos like yoga. Yoga is a great one to look up. They have many things for chair yoga or Pilates that you can find, and you can pause that. Like Mindy said, take time to really know what the exercise is and continue through that. Another one that I want to talk about is sit to stand. So getting up from your chair. So really making sure that we can get up from our chair. That's very important. If we're not able to get up from our chair, we're not able to continue to be active throughout the day. So that may vary from many different surfaces. So thinking about getting up from your sofa chair, or getting up from the dining room chair, or getting up from the toilet. Those can all look very different. So the sofa chair is going to be a little bit lower, sits a little bit more soft, as long as we're not raising those elevated chairs up, keep them down, but that's going to be your hardest part. So trying to think about maybe starting at your dining room table. Use that chair. It's pretty sturdy. Some of them have armrest. Are you needing to use that armrest? So really pushing from that armrest to stand up. Maybe we have grab bars in the bathroom to help with that a little bit more. But really trying to keep you active and making sure that we're able to get up from the chair is going to keep you more independent throughout the day. The other thing that you can do too is using assistive devices. So I wanted to talk about a cane, a walker. We have two different ones here. So we have the 4-wheel walker. This is the one that has the seat, and it also has the brakes. So I like this one as you are walking maybe to the mailbox. If you get tired, you're able to sit down, turn around, make sure we have the brakes on, and then take a little break. The other thing that I really like about the 4-wheel walker is that we're able to maybe put our hot coffee on here as we're going to the kitchen table. So it really gives you a little bit more support as you need. Otherwise, we have our standard walker here, and this one gives us the most support. So maybe you're needing a little bit more support throughout the day, taking it around, getting to where you need to go with the more steady support. The one thing that this one doesn't provide is it doesn't have that chair or seat if you need to sit down. Okay, now, I think we have enough time, right? All right. So, like Mindy said, we have this handout for you. So that very first picture on there is that sit to stand. So really practicing standing up from your chair and sitting back down. So on there we have about 10 reps. So not only do you do that throughout your day, but really trying to focus on doing 10 reps at a time. Maybe you can only do 5 and your legs start to get tired. That's okay. Start at 5. Start wherever you need to. But thinking about how much are you using your hands, okay? We really want to try to be able to not push with our hands. Really make that work come from your legs a little bit more. The next picture, picture 2, is just seated in the chair, and I like to call it marching. So just thinking about lifting your knees up as if you were marching. You can change it if you feel comfortable. You can always change it to a standing and holding on to something. Very simple to change. Okay. The next picture we have squeezing a ball. Don't go out and buy a ball. You can grab a pillow at home. You can roll up a towel, whatever you feel like you need. But then we're just squeezing in with those legs and then relaxing. So really working on those inner thigh muscles a little bit more. And then the last one here on that bottom page is kicking straight out in front of you. So really trying to keep that range of motion in those legs and keeping those knees moving a little bit more. Do you want to go over? Okay. And then the last one for the legs here, we just have a nice stretch. So as you can see, they're sitting in their chair, another chair in front of you, stretching out the back of that leg. And that's typically where we get a little bit tighter as we've been sitting for a little bit more, not being quite as active. So it's really important to keep the back of the legs, the hamstrings, nice and stretched out. The next picture I'll just go over really quick. Working on a little bit more of shoulders. So arms are out to the side, raising both arms up and then back down. Making sure that you're not pushing into any pain if you are having pain. Trying to get those shoulders as high as you can or those hands as high as you can. The next picture on the back of the page, I really like this one to help with not only shoulders, but also to help keep your trunk moving, keep your back and your back mobile. So you're gonna sit in your chair, reaching the arm out to the side, and then you go a nice reach across the chair. Okay, so that really helps, making sure that you always go both directions. Don't hit your partner back there. Making sure that you're going both directions to keep that mobility in the spine both ways. And then the last one is just that simple little curl, bicep curl. You can always add weight with that, so you can grab some soup cans. If you have a little bit of weight, 1 pound dumbbell, 2 pound dumbbells, whatever you feel comfortable with at home, you can always add that in a little bit more at home as you start to get stronger. So we say working from 10 reps up to 20. Once you get comfortable with 20, definitely adding in a little bit more weight to that. Does anyone have any questions on the exercises at all? Perfect. I will give it over to Allison.
Thank you. Good afternoon. My name is Allison Tupper, and I am a speech-language pathologist. And I love to talk, so I'll try to keep this as brief as possible. You give me a microphone, and I'll be here all day. So my two colleagues have just talked about how to keep your body healthy. Speech-language pathology, or speech therapy, is going to focus more on everything from the neck up. Okay, so my background, I have my undergraduate degree from University of North Dakota. Fighting Sioux was when I, woohoo, okay, go Hawks. Go Sioux, Sioux, yeah. And then I got my master's degree at the University of Nevada in Reno. I lived on the West Coast and in the mountains and near the ocean for a while, and then my husband and I decided to move back to this area with our kids from Colorado Springs. We've been in the area for about 4 years, and I've been here at Astera Health for the last 2. Here, I do work with adults and children. So I get to see kiddos, which a lot of people think about as the, speech therapist or speech teacher helps kids learn how to talk. But we have a big umbrella that kind of goes over speech therapy. And I even go in the hospital and people say I can talk just fine, but we may be working on some of the other things, such as cognitive and memory changes. Swallowing, so any difficulties with being able to chew or swallow. And then language, word finding difficulties. It's the, that thing that we keep over by the stuff, that kind of thing. You all know it. It happens to us every once in a while, but for some people that can become more of a bigger issue. And that's something that we work on, as well as voice changes. and so changes with the vocal cords. And then, of course, changes with speech in general, which more than likely will be happening because of something, a diagnosis. Parkinson's, a stroke, multiple sclerosis, things like that might change speech function. So there's lots of things. I could talk for hours. I love my job. I could talk, like I said, for hours on all of these topics. But today I'm going to focus on just kind of the 4 healthy aging tips for more of the cognition and memory. And I'll back up. Cognition it refers to any sort of brain function and activity. So that can be memory, can be attention or focus. That can be things like coming up with the right words, remembering names, remembering what thingies are called. And then that can also be kind of those processes of understanding, following a conversation, being able to kind of keep with what other people are talking about, and then, of course, remembering what I was supposed to say and responding to what you say. And so kind of just that higher level, being able to stay up with what's going on around you. So when we talk about healthy aging tips, there are 4 big ones. And the first one, to keep our brains as healthy as possible, is to get good rest. Good rest is typically 8 hours of sleep at night, and typically, and maybe a nap or a rest during the day. And resting your brain can just be kind of a lie down or rest your eyes, as my grandpa used to say. So it's being able to do that and getting healthy sleep throughout the night. Now, don't ask me for good healthy sleep tips. That is something you'll need to address with your doctor. I think we all struggle from time to time with getting good rest, but that really does help. So a lot of times when people come into my office and they want to know about, well, I just feel fuzzy and off and I can't remember, we talk about sleep and sleep hygiene and how to get good rest. And sometimes we need to bring your doctor in to figure that out. The next one is proper hydration and nutrition. So making sure that we're getting really good hydration specifically throughout the day. Water. Unless you have a contraindication from your doctor as to not drinking water, that is the main one. So yes, coffee is hydration, but it's not the same as getting good fluid intake, which can definitely impact our brain function. And then, of course, nutrition, we've heard that forever, is getting away from processed foods. Lots of sugars, things like that can actually impact our cognition. There are books and diet plans, and there are so many different things out there about what you should be eating, and it changes probably every 5 years. It changes for the new diet plan. But I'll give you a couple good ones. Berries. Specifically, the darker the color berry, the better it is because it has antioxidants, which can help with cellular regeneration and development. So blueberries, strawberries, blackberries, you can put them in smoothies, you can emulsify them, you can eat them whole. They're absolutely wonderful for brain health. And that there's been many, many studies on that. So I feel very confident talking about that. So that's the kind of free tip that I give people, is berries is a great one. And actually the current research shows if you can get 3 servings of berries a week, that can actually improve over time, improve cognitive health. I don't know about you, but I could eat 3 servings of blueberries a day, but 3 a week was the minimum. That actually showed some good brain recovery. And like I said, that could be smoothies, that could be mixed in oatmeal, that could be sprinkled on a salad, or just whole. The next is movement. We know that movement helps promote blood flow, which helps get blood up to the brain. Blood brings oxygen to the brain. So therefore, it keeps our brains healthy. So they're talking about moving. I'm going to jump right on that bandwagon. It helps a lot. Also, when we move, we have to think, we have to look, we have to pay attention. That keeps our brain mobile, functioning. And the last would be actually conversation and socialization is one of the highest level brain functions that we can do. You don't know what I'm going to say. I don't know what you're going to say. I have to pay attention and listen. I have to react and respond. I have to formulate what I'm going to say. So just having conversation back and forth can be a huge cognitive booster. And so that's one of the greatest things we can do. I do have a table over here, and you're welcome to come up and peruse it, of some of the different brain activities that I like to do within my therapy sessions with my patients. That's not all inclusive. Anything. Candyland is wonderful for your brain. It's not hard, but you still have to look and play and do. So you don't have to do calculus or, physics to be working your brain. Very simple tasks can do it. Some of my patients, I just have sort out a deck of cards. Every day they shuffle it, they put all the aces together and the hearts together, and they just shuffle through a deck of cards. But there are a plethora of different games and ideas. So if you were wondering, I'm by myself at home, how do I play cards with someone if there's no one there? There's lots of different brain activities you can do all on your own that keep brain function going if you don't have the ability to converse with someone. But finding things in the community, places you can go, coming to places like this, coming to talks like this, is good for your brain. We do know there's no medicine to help with brain function. There are certain medications that may help certain processes of diagnosis of dementia and things like that. But as far as some magic pill out there that you can take on the market that says that it will help with memory and function, there is no definitive medical studies that have proven that one will help. So unfortunately, I can't I can't promote any of those, nor can we find any data that does promote that. What we do know is these 4 components, if you can improve or focus on them, can do wonders. And the last thing we're just going to kind of touch on, and then we can answer any questions you have, is the importance of early intervention. If you feel like you would benefit from physical therapy, occupational therapy, or speech-language pathology, we would need a doctor's referral. So talking with your primary care doctor, or if you see a specialist, they perhaps can write a referral for you to come to see our rehabilitation department. An evaluation doesn't mean you're going to need therapy. I evaluate people's cognitive function all the time because they want to know where they're at. They don't necessarily need to come in for therapy. I get it a lot. My grandma had Alzheimer's. I had 2 aunts who had dementia, and I'm nervous that I might be developing down that road. What can I do? We'll do a test. We'll see where you're at, and then you can take the results and do with it what you will. Same with physical therapy and occupational therapy. If there are certain skills that you feel like you may want addressed or evaluated, we're happy to evaluate those. It doesn't mean you're going to get signed up for 3 months of intensive therapy. We're going to give you as much and develop a plan that works for you. And if the outpatient model, what we do here at our clinic, is not appropriate for what you need, then we'll help you find the services you do. Most of you guys probably walked in here, drove here, so you probably would meet the outpatient model, but we have had many times where we've said this would probably be better suited for home health. Or something of that nature. Or you know what, you don't need a lot of therapy, but maybe getting into the MAS and seeing a personal trainer might be more of what you would need. So we are going to find the best thing for you. If you're from Perham, then we'll get you to the right services in the right town. But if you're within our community, I think we provide great services here. And we'll make sure that we get you what you need if that is something you truly do need.